Hello, my name is Neil Harpstrad and I'm with Ambu. Today I'm going to talk to you about our adult spur 2 with our different variations. We have our adult spur here with a 40-inch tube reservoir. We have an adult spur here with a 2,600 milliliter closed reservoir, and then we have our adult spur here that is collapsed for storage purposes. Today I'm going to focus on our adult spur with the 2,600 milliliter reservoir. We have a perforation here that is a tamper-proof perforation. What that allows you to do is pull that off, and then you'll know if that's not there, that that bag has been tampered with or used, or something may be missing in that bag. You'll notice when you pull the bag out, our mask will be attached. We're going to take that off and we're going to set that aside for just a minute. And we're going to start at the back of the bag and talk about that and move our way forward. So first of all, we have a 2,600 milliliter reservoir here. This is a very lightweight gauge plastic. It's designed that way for a number of different reasons. We also have our green oxygen inlet so that you can find oxygen very quickly and easily and attach that to oxygen that way. Next, we have our compression unit. Our compression unit is 1,475 milliliters. You'll also notice that it has two very defined seams in it. That is for storage purposes to protect the integrity of the bag so it does not become infective. And we also have this integrated handle. This handle is there so you can put your hand in there and give consistent ventilations. It also is there so you can rest the bag with control the bag with your arm and shoulder, and rather than having to constantly grip it, it helps reduce hand fatigue and blistering. The next thing we'll talk about is our medication delivery port. This is here so that you can deliver any type of cardiac care medication through the bag. You also will have our unique shutter valve membrane here that is very large. It's a free moving valve. It's unlike your traditional duckbill valve. We're the only ones on the market with this feature. The next option that we have is our standard deflector cap. This is standard on all of our resuscitators between adult, pediatric, and infant. This is here so that if you have any material that regurgitates up through the bag, it will catch that and will deflect it away from the clinician. It acts as a safeguard to protect you from any cross-contamination. To remove this, just pull it away, and you would take our Ambu standard Peat valve and you would place that on there. Just push with a little twist, and that will allow it to have a friction seal, which makes it very difficult to fall off when you're using the resuscitator. The next thing we'll talk about is our mask. Our mask has that quick tearaway dust cover. That is there so that if you happen to have the mask fall away from the resuscitator when you're pulling it out of the bag, it falls to the floor, to the bedside. It protects it from being contaminated or soiled by other materials. This is just a quick tearaway material, so it just pops right off like that. The next thing you'll notice is we have a very defined bridge here. This bridge is so you can grip that mask very easily, especially if it becomes soiled. It allows you to control the mask and get a good seal. The next thing we have is this very defined nose bridge. This helps you seal the mask around the nose where it's often very difficult to get a seal. This aids in that when you're ventilating with the bag. To apply the mask, you would just simply put it on here. It slides right on. And then one nice feature about our bag is you can actually twist 360 degrees this way to be able to rotate that handle out of the way if you do not want to use it. And then you also have 360 degree rotation this way so you can swivel the bag in any direction that you may choose based on who needs to do the rescue breathing. And with that, that concludes our in-service. Thank you very much for watching.